Did you know that crowns can improve your smile? No. I'm not talking about this crown. I'm talking about these crowns. This is a patient of mine, and I'll tell you a little bit more how crowns transformed this man's life. Hi, Dr. Dela Cruz here, and today I'll be talking about dental crowns, what it's used for, and how they can help you avoid costly mistakes. A crown is a cap that covers the entire tooth. Besides fillings, crowns is the most commonly performed procedure in dentistry today. It is used to fix large cavities, broken teeth, root canal treated teeth, weak or worn dentition, and lastly aesthetics. Although I'm not a fan of that unless it is the only option. So in my office, the most common question that I get is, can you just do another filling? It is very common to see teeth that have had filling after filling after filling. Well, unfortunately, this cannot continue on forever, otherwise you're not going to have any tooth left. So in this photo, what I'm showing you is a large filling, a silver filling with multiple cracks running through the tooth. And after all that has been removed, you can see there's not a whole lot of tooth left, so the better option in this case is to actually put a crown on the tooth. Now we also use crowns in conjunction with other therapies like root canal therapy, which leaves your tooth brittle. So if you happen to bite down on it just right, you can easily break the tooth. Now let me tell you a little secret. If you are anything like myself, things will happen at the worst time. And unfortunately for most of my patients, when they break their tooth, it is at the worst time. Lastly, crowns are used to align misaligned teeth to give you that kind of better smile. And later in the video, I'm going to show you a patient of mine who we combined all these treatments to transform his life. So there are four main types of crowns in dentistry today. The first one is the metal types of crowns, which is either stainless steel or gold. And this is a common treatment back in the day, but you don't see a whole lot of this today because for most people it's an aesthetic issue there. Unless you're in the entertainment business, then that might be perfect for you. Okay, the second type of crown that you'll normally see is what we call a porcelain fused to metal. What this is a metal substructure, and you have porcelain that's layered over the top of it. Although it is nice at first, over time this can chip away, or if you have any receding gums, you'll see that kind of gray area right at the gum line. So this can also pose an aesthetic issue. I don't see a whole lot of PFM crowns today, but they're still very common. Number 3 is all ceramic or porcelain crowns. These are usually made out of what we call Emax or zirconia crown. Zirconia is one of the hardest materials we have in dentistry, and they are perfect for molars just because they can take a beating without cracking and having those major issues. And then the last one, number 4, is all resin crown. Basically, this is a filling that is made out of a crown. Unfortunately, that filling material is nowhere near as hard as regular crowns, and so those can easily chip or break. So it's more of a temporary fix for the time being. Okay, so I wanted to share with you a personal case of mine. This is a patient that saw me about 7 years ago. He was a 35-year-old male that presented with dental pain and severe social anxiety. Okay, so he never even really spoke to people. He didn't smile. In fact, he kind of avoided eye contact at all costs. And so he came in with this. We actually performed root canals, build up on the teeth, and we actually did crowns on the front 6 here. And so he spent about 4.5 hours in the chair, and he went from this to this. Okay, now this is just his temporary teeth, which he got to wear for about 2 or 3 weeks, and then we put the final crowns, which is this. As you can tell, these are a lot more aesthetic. There's a lot more detail, and these are the zirconia crowns that I was telling you about a little bit earlier, and they turned out great for him, and his social life got a lot better after this. Okay, so dental crowns are the most versatile treatment that we perform in dentistry today. For some people, it can work miracles. So if you're having some dental problems, I urge you to go talk to your dentist. Maybe you need it, maybe you don't. If you find this information useful, please consider subscribing to the channel and share it with others. Until next time, take care.